One of the things that has surprised me the most since starting to practice in the Cayman Islands has been the amount of women with iron deficiency anemia and the degree of anemia that women are presenting with. I trained and practiced internal medicine in the United States, and while I certainly saw women there with iron deficiency, it was not nearly as severe as it is locally. So, what is anemia? We have red blood cells in our body that carry oxygen to our tissues. This oxygen is required for cellular respiration. It's what makes energy. It's what allows our organs and muscles to function. And when we have little oxygen in our red blood cells, we typically feel tired and we see the symptoms of anemia. The oxygen is carried by hemoglobin, which is a protein that requires iron to be formed. So if your iron is low, your hemoglobin levels will be low and you will have iron deficiency anemia. There are other types of anemia, but I haven't noticed those to be any more prevalent locally. It's the iron deficiency that seems to be the issue. So many women are coming in with hemoglobins less than 10. We want it at least 12, 13. I've had people with hemoglobins in the sixes, which does require a blood transfusion. Many of these patients have to start with IV iron. That's where we put iron through the vein instead of the oral tablets, just to boost them up to a level where we can switch to oral tablets and then maintain them that way. Why is this happening? Again, it could just be a sample bias, just that the patients I'm seeing tend to have more iron deficiency and it's not actually more prevalent across the island. Maybe people are just showing up later to their doctor. Maybe they're coming in once they have symptoms. They don't come in for an annual physical. In the United States, the insurance does cover a bit better. And sometimes in the United States, for certain insurances like Medicare, you have to do an annual wellness exam. So you are getting your labs every year. Other women are coming in the Cayman Islands maybe years after their last baby. We know that pregnancy will drain your stores, your iron stores, your calcium stores. So if you did not replete during or after pregnancy, that can snowball over years, especially if you have pregnancies back to back. And you might end up with very severe iron deficiency anemia years after your last baby. And now you're just going in for your first set of labs and you are depleted completely. Maybe nutrition can factor in, especially given the price of iron-rich foods in the Cayman Islands, like lean meats. Maybe fibroids, which typically will cause iron deficiency anemia in women, might just be more prevalent locally. It could be a genetic thing. But either way, it's important to know the signs of anemia. So like I said, you can feel fatigued, dizzy, short of breath. You can have restless leg syndrome, which is cramps at night. Just tired all the time, not feeling yourself. The issue with iron deficiency is that it doesn't happen overnight. So you're not going to suddenly wake up with these symptoms. It's going to gradually worsen over years. You might just chalk it up to getting older, stress. This is something that we want to check with labs. You just come in, pop in, we'll do some labs, check your CBC, check your iron stores, and then go from there.